Alright, so hello everyone, and here we have with us a patient who is scheduled in a while for a genioplasty, an angle osteoplasty and a rhinoplasty surgery. So if you see, this patient has a double chin, also has a jowling. So all this is going to be corrected. We are going to give her a more angulated lower jaw. It's going to be like a V-line aesthetic surgery. Also, we are going to augment the chin both in the horizontal and the vertical plane. And she's already had a rhinoplasty a few months ago elsewhere. And we are going to do a revision rhinoplasty because she says after the procedure her nose has flattened, which is true. So with regards to the nose, it's going to be more focused only on dorsal projection, dorsal augmentation, and this is going to be open structure septorhinoplasty with rib grafting, with genioplasty and a bilateral angle osteoplasty procedure. It's going to take us a few hours to finish this procedure, and we'll show you the post-op results shortly. Thank you.
The angle, it's going to be facial slimming procedure. You can see how her face is right now. We're going to be reducing the width and increasing the height by doing bony procedures in the ramus, body and the chin. So we've done with the facial slimming now. We've increased the height of the face anteriorly by means of chin augmentation, and we've also increased the projection, and we've decreased the projection and increased the angulization at the ramus. So now we've given about 110 degrees. We're going to show you how she looks. See the improvement. The double chin also has been improved significantly. Okay, now I'm going to show you the front view. Now, well, it's still swollen, but we're going to make it much more angular. You can see the proportion from the nose till the chin. You can appreciate that difference. The difference on the sides I already showed you in the earlier view. Rhinoplasty, actually septorhinoplasty with septal reconstruction and nasal osteotomy done. We're going to show you first how she's looking now. You can see the plasters because we've also done a facial slimming procedure at the same time. So at that time we had given nasal intubation. There's a different view of the nose that you're seeing. Septal extension grafts, tip grafts, marginal rim graft.
बुलाएंगे।
Oh, sorry. Hold a second. Okay. കുറച്ച് വെയിറ്റ് ചെയ്യണം ജസ്റ്റ് ഓക്കെ so this is 7 days now. You can see her before while we remove the compressive rhinoplasty. So we've done for her a genioplasty, jaw sculpting, angle osteoplasty, which was bilateral, in order to slim her face down, in order to augment the facial proportions. We've also done rhinoplasty. We're going to show you everything. 1 second, beta. Okay. Okay, right. 1 second wait chedo. Side view ka. Right. So there's still a lot of swelling because we've done a lot of bony work. Okay. Over. Right. Free aile. So we're also going to take the splint of the nose. Front view. Okay. So this is a lot of swelling. It's all going to go in. This is just 1 week after a major procedure. You can see the proportion in her face. You can see the nose is being narrowed significantly. From there it has been made more proportional. Kando enganunde before. So she doesn't live very far from here, so we're probably going to get her back after a few months. അടുത്തത് വരണം മനസ്സിലായില്ലേ വന്ന് ചെക്കപ്പ് എല്ലാം ചെയ്യണം ബിക്കോസ് നിങ്ങൾക്ക് സ്ഥല ദൂരമില്ല അപ്പം ഇന്നും അത് ക്ലിയർ ആവും ഇത് സ്വെല്ലിംഗ് എല്ലാം പോകുമ്പോൾ നന്നായിട്ട് ചുരുങ്ങി വരും ആൻഡ് ഇവിടെ ഇപ്പോൾ ഞാനൊരു ടേപ്പ് ഇട്ടിട്ട് അയച്ചുവിടാം ആ ടേപ്പ് നിങ്ങൾ നാട്ടിൽ വീട്ടിൽ ചെന്നിട്ട് ഒരു 3 ദിവസം കഴിച്ച് എടുക്കുക 5 ദിവസം കഴിച്ച് വീണ്ടും വരണം 5th day. Alright, so we've done work on the chin, submental region, here and nose, and also we harvested rib so that we could augment the nasal tip, the radix, and that was for the open structure rhinoplasty. Okay, so this is what we've done for this pretty girl. So you can see the nose has been narrowed, and this was a revision nose job. This is 2 weeks after surgery. You can see the proportion of the chin and the angle. I want to show you some other views also. Side view irka. Yeah, so ingane kando kanichu. So you can see the angle, the double chin that has been totally obliterated now. The increase in the height of the chin, increase in the facial proportion, the decrease in the width, and you can appreciate all of this. The place of the nose is starting from the nice gentle curve, and then the narrowness, improvement in the tip shape, in the chin, the lack of the double chin, which is all gone now. You can see that there's a very clear angle now. East side nokanam So again you can see the improvement. So the vertical height has been increased a little bit. So the work that we did was around the chin and around the lower jaw to reduce the width of the jaw, to increase the height, to make it more V-line, and also work on the nose. She's got a lot of small pimples on the face now because she hasn't been washing her face since the pack was removed. That was like a week ago. Alright, അപ്പം ഇത് ക്ലീൻ മാത്രമേ ചെയ്ത് വിടുക. മേലെ ഒരു ഓയിൻമെൻറ്റ് ഇടണം, പിന്നെ ഒരു മാസം കழிച്ച് വരണം. ഓക്കെ റൈറ്റ്. നിങ്ങൾ மேலே 30% ஆயின்மெண்ட் கொடுத்து அப்ளை பண்ணிவிட்டு ஒரு மாதம் கழிச்சு வர சொல்லு.